Hello, my name is Gregory Rogers. I'll be doing my speech on cancer. Nearly half of all men and one-third of all women in the United States will develop some form of cancer during their lifetime. Cancer usually kills about 580,000 people a year, which is roughly a little over 1,500 deaths a day. That's why it's important to know just general knowledge about cancer. It affects millions of people every day and does not discriminate. And chances are, with as many people that get affected, you may know someone, and this information may be able to help you. So in this speech, I will discuss what is cancer, what are some of the common forms of cancer, what are some treatments, and what are some misconceptions that people hold about cancer. Now, the National Institute of Cancer defines it as an abnormal cell that grows uncontrollably and will not stop growing. Now, this differs from a normal cell because in the early stages of a person's life, a normal cell will grow at a rapid pace in order to encourage growth through your body. But as you become an adult, these cells stop dividing and then they eventually start again, only to replace dying cells or worn out cells. Now, cancer is also different because cancers can invade other parts and other tissues in your body and lead to tumors. Now, not all tumors are cancer. Tumors that are not cancer are called benigns, and these are called by other sources. And the reason that a tumor will form is because it'll pass through, say if it starts in your pancreas and ends up somewhere else in your body, it'll start to form and build, and this is usually because the antibodies that in your body that fight tumors will have stopped working, which led to the tumor forming. Now, some of the most common forms of cancer are skin cancer and lung cancer. In the United States, nearly 2 million people last year were diagnosed with skin cancer. Most skin cancers are curable. The only one that's not is melanoma, and a skin cancer last year alone contributed 75% of the deaths caused by cancer. Now, lung cancer is the second leading most common, but it has a lot less diagnosis. It's diagnosed at right around 226,000 a year. Lung cancer, has a 16% survival rate in the past 5 years, so it's really starting to improve on that rate. The next thing I'll talk to you about are some of the treatment options available for those who have cancer. The most common treatment options are surgery, radiation, and chemotherapy. Now, surgery is essentially just going through your body and cutting out the tumor where the cancer is and in the surrounding area to prevent it from growing back and starting up again. The next one is radiation, and this is when doctors use X-ray rays and particles to kill the cancer. And the third one is chemotherapy, and this is when a person chooses to take pills as opposed to going through radiation or surgery. And by taking pills and with radiation, both have the same effect. But it stops the cancer's ability to grow. So eventually it'll start contracting and it'll go away if the pills and radiation works. And the last thing I want to talk to you about are some of the misconceptions of cancer. A lot of people believe that cancer, the death rate for cancer is growing, when actuality it's dropped 20% since the 1990s and continues to grow. The leading reason for this is that with improvements in technology and better treatments and earlier treatments too, we can stop cancer from growing. Another misconception that a lot of people have about cancer is that all treatments are the same, and this is not true. Each treatment is tailored to each patient and each person. Everyone's different. Everyone's cancer is different, so you can't approach everything. You can't approach someone who has skin cancer the same way someone with lung cancer will have it, or to someone who has another form of cancer, because they're all different. And another misconception is that only men cannot get breast cancer, and that is not true. A lot of people believe that only women can get breast cancer. And then last year alone, nearly 2,000 cases of breast cancer were reported in men. And another misconception that a lot of people have about it that is breast cancer is hereditary, and this is not true. While if breast cancer runs in your family, you are a lot more accessible to getting breast cancer, but it will help by getting tested for it, and if you do have it, getting treatments for it because it runs in your family. It's a precaution that a lot of people would take. And really, in conclusion, you should know that cancer is an abnormal cell that grows uncontrollably in your body, and it can invade other tissues. That's why it's very important to start fighting cancer and getting treatment as soon as possible. Because the sooner you find the cancer, the more likely you are to be able to treat it, cure it, and either live with it or beat it. Uh, and I just want you to remember that anybody can get cancer. A lot of people every year die from cancer. A lot of people are diagnosed with cancer, and it affects millions of people every day. Chances are someone in this room knows about it, knows someone that has cancer, so it's important to just to have a little information about it and be well informed. My name is Gregory Rogers. That was my speech on cancer, and thank you. You have a nice day.